Dr. Maria Angela Simao, Assistant Director General, Access to Medicines and Health Products. Welcome all. Simultaneous interpretation is provided in the 6 UN official languages plus Portuguese and Hindi. Now, without further ado, I will hand over to our Director General, Dr. Tedros, for his opening remarks and for him to introduce our guests. Dr. Tedros, you have the floor. I think you are muted, Dr. Tedros. He's still muted. Dr. Tedros, can you hear me? He's talking.
He's muted.
You are muted, Dr. Tedros.
Can you hear me now?
Ah, good. Go ahead, please.
I think there is a few minutes lapse, pause time, I think. Okay. Good morning, good afternoon, and good evening. In the summer, Africa was certified as wild polio-free. This marked one of the greatest public health achievements of all time, driven by millions of health workers reaching every child repeatedly with an effective vaccine and a unique partnership between WHO, UNICEF, Rotary, CDC, the Bill and Melinda Gates Foundation, and Gavi. Global polio eradication remains achievable. However, the COVID-19 pandemic hurt momentum as polio and immunization efforts were suspended. This left children, especially in high-risk areas, more vulnerable to killer diseases like polio, measles, and pneumonia. And now we are starting to see outbreaks of this disease. We need to turn the tide quickly and ensure no child is left behind. Today, WHO and UNICEF are jointly launching an emergency appeal to rapidly boost measles and polio vaccination. While the world watches intently as scientists work to ensure safe and effective vaccines are developed for COVID-19, it's important to ensure that all children receive the life-saving vaccines that are already available. We estimate that $655 million is needed to address dangerous immunization gaps in children in non-Gavi eligible countries. This is a global call to action for all donors to stay the course and not to turn their backs on the poorest and most marginalized children in their hour of need. While the COVID-19 pandemic continues to evolve, we must take all opportunities to learn and improve the response as we go. Many countries heard our call back in January when we rang our highest alarm by calling a public health emergency of international concern. They worked closely with us and followed the parameters set out in the strategic response plan that WHO outlined on the 4th February. They have conducted reviews, shared data and experience, and honed their response to their national experience and unique situation on the ground. As the pandemic unfolds, as countries have reflected, they have used interaction reviews to make their responses stronger. This kind of self-analysis review is what the world called for during World Health Assembly back in May. An interaction review uses a whole of society multi-sectoral approach, acknowledging the contributions of all relevant stakeholders involved in COVID-19 preparedness and response at the national and subnational levels. By reviewing and adapting the current preparedness and response strategies and identifying what's working well and what needs to be strengthened, the review gives countries the opportunity to change the trajectory of the pandemic. Intra-action reviews not only help countries improve their COVID-19 response, but also contribute towards their long-term health security. To date, 21 countries have completed them and others are in pipeline. Today, we're happy to welcome the Ministers of Health from Indonesia, the Kingdom of Thailand and South Africa to share their experience and lessons from COVID-19. I would like to first introduce His Excellency, the Deputy Prime Minister and Minister of Health of the Kingdom of Thailand, Deputy Prime Minister Anutin Charnvirakul. The floor is yours, Your Excellency.
Dr. Tedros, Director General of the World Health Organization, health ministers, colleagues, member of the press, I send you greetings from Thailand. As you know, Thailand was the first country outside of China to detect the case of COVID-19. And since then, we have been working around the clock to prevent the spread of the disease. Several strategies are employed, such as comprehensive case identification, rigorous contact tracing, and quarantine. Thai people are well complied with the social measures of wearing masks, hand hygiene, and physical distancing, resulting in effective controlling of the spread of COVID-19 in our country. We have maintained zero local transmission for many months. Nowadays, few cases were detected in the quarantine area. We are well aware of the need to continuously improve response to COVID-19 to protect the health of all people across the globe, including Thailand. So, the joint intra-action review of Thailand's response to COVID-19 was critical. It was conducted during July 20th to July 24th by 16 reviewers from diverse backgrounds, ranging the experts from WHO, UN agencies, US CDC, and to the academia. I thank the review panel who interviewed 96 Thai policymakers, technical experts, and respondents, and all relevant persons who contributed to this review. The reviewers made their observations and recommendations based on consensus. They highlighted the factors that helped Thailand successfully control the spread of COVID-19 so far. That include decisive leadership based on the base scientific evidence available, our strong public health system, and the strong whole of society approach across sectors. Cooperation and collaboration with all concerned sectors among the public and private sectors, civil society, and many institutions played important roles in breaking the chains of transmission. My highest appreciation is going to everyone in Thailand for their collective effort in curtailing the outbreak in our country. Besides our strengths, the review identifies that challenges for further improvement. First is to integrate information around COVID-19 and maximize its benefit. Second is to expand our surveillance systems by improving capacity to detect cases and increasing more efficiency of our emergency operations centers. Third is to advance the integrated digital data system for managing the situation and ensuring health security for everyone on Thai soil. Distinguished colleagues, IAR report reminds us the strengths that we need to maintain. At the same time, it advises us that the challenges we need is to address. We commit to improving our response to COVID-19 by working closely with relevant stakeholders. In this regard, I would like to thank all of our partners who have worked with us on the report, including WHO, various UN agencies, US CDC, and national colleagues in the academic sector. My special thanks is going to my colleagues at the Ministry of Public Health and all health workers who provide services across Thailand. Finally, I appreciate the role of the media and in disseminating and advocating news and information that helps us communicate with the public more effectively to prevent the spread of the disease. Only together can we win the COVID-19 pandemic, and we shall win. Thank you very much. ขอบคุณครับ
Sabadi Kap.
ขอบคุณครับ
So thank you so much, Deputy Prime Minister, for those insightful remarks and lessons regarding Thailand's response. I would now like to welcome His Excellency, Minister of Health, South Africa, Dr. Zwelini Mikize. Your Excellency, the floor is yours.
Thank you very much, Director General, my brother, Dr. Tedros, honorable ministers, representatives from various countries in the departments of health, and members of the media and the public. I'd like someone to help me share the slides from your side, if that is possible. Thank you very much. I'd like to just take a quick walk through our journey on the COVID-19, and therefore I'd like to go to the next slide. The presentation is just going to give us a quick overview, and then why are we going to interaction review, what lessons have we learned and the way forward. Next slide, please. This gives us a sense of the journey of the South African COVID, the fight against COVID. All the red lines there indicate how we've moved on the heavy lockdown and went downwards in a risk-adjusted way until we got to level 3. And then, of course, you'll see that that's when the surge started early in June, and then up to July when we're 13,000 positive tests per day. And then it started declining. And thereafter, when it was to plateau, went to the next level of the lockdown. We've continued on a plateau now. And at this point, we've even started opening up international travel. Next slide. At this point, we have got 1,500 to 2,000 daily new positive cases, 732,000 cumulative cases, 91% recovery, and 2.7% fatality rate, and 41,000 active cases. Thank you. Next slide. This is the toolkit. I think all of us have used this, from governance to case management to tracing to tracking to information to human resources and all the issues that we've had to employ. Next slide. Through this interaction review and on our own evaluation going back, we've learned a lot of lessons. Firstly, that the issues of national coordination, leadership, and governance with various structures become important. Evidence-based response is important to ensure that science leads everything. The strengthening of emergency procurement processes, excuse me, to mitigate against corruption. Strong primary health care is important. Issues of fatigue must be given attention to. Close collaboration with labor and other social partners. Public-private partnership is important. harnessing of power of technology, digital contact tracing is also important, and information dissemination, and issues of continued vigilance and aggressive response to cluster outbreaks, continued assessment of capacity of projected multisectoral and multifactorial impact. It's important to know that we need everybody to be touched by our response on this matter. The economic impact is a major issue. The country and the citizens and the poor have to be protected, and that the impact of COVID and non-COVID health services is also something that we have to take into account. Next slide. This is how, as we observe at subnational level, we've still kept the plateau, but there are indications of clusters breaking up and showing a slight increase in some of the areas. And so we're watching over that, and that's why the inter-action review becomes important. Next slide. And the concerns that we have to take into account at this point, which is why we have to focus on this inter-action review, is that there's pandemic fatigue in the population with low adherence to public health measures, exhaustion and fatigue in the frontline workers, whom we must thank for all the work that they've taken in fighting this COVID-19, even if they themselves became victims, ensuring that they're well protected, well trained, and well motivated. And then, of course, we take into account the possible resurgence that can be made worse by the factors above, and also the delay in the vaccine still keeps us vulnerable. And then, of course, resources which are dwindling, and we've had to move resources from various other functions of government to actually help to fight the pandemic. So these are some of the issues that we are now taking into account. Next slide. So in our case, we're very grateful for the support of our international partners, led by the WHO. Using the WHO methodology, we volunteered to work on this, and we've gone right to involve already 8 of the 9 provinces have already conducted their intra-action review. And then we've got a team of 35 WHO search personnel who have come in to reinforce our technical experts on the ground. Next slide. Of the lessons that I've indicated before, amongst the issues we've looked at is that the value add of intra-action review is that it shows us best practices. It enables us to be able to record these and put them into across all pillars, and then institutionalize them. It also helps us to identify gaps, in this case, to ensure that our next response is actually seamless. The next is the revision of the response plans, that we have plans which are now localized at lowest local level at districts, so that everyone is able to respond without waiting for the national response, but they must know what they need to do. Then, of course, there are long-term recommendations that have been put in place, and then we're looking at this with continuous follow-ups. So it's a whole cycle now of response, intra-action review, resurgence readiness, and of course response, and that continues. And this is now what we are preparing for, and we believe the support of WHO has been very helpful to make us to be ready psychologically to face whatever comes as the next resurgence possibly comes up. Next slide. And here, learning from other countries that are experiencing COVID resurgence, measures have been taken to prepare for, detect, promptly respond to the resurgence. There is a national plan now for action to mitigate COVID-19 resurgence, which has been developed. Provinces are currently developing their resurgence mitigation plans. They incorporate early warning systems, as I was saying, broken down right to the district level. And all the provinces now are remaining on high alert. And so every day as we watch, we look at where the clusters are breaking up. We've seen in the western part of the country, eastern part of the country. All of these are indicating our state of alertness. And this is now based on the plan from the WHO resurgence plan. Next slide. Here we've just got a quick indicator. Everyone has to look out for anything that's less than 10% increase or decrease is under control. Between 10 and 20, it puts us on alert. Now we're looking out for over 20% increase. That's indicating resurgence. And these are some of the key lessons that we have got from our intra-action review, and the plans that we have developed together with the WHO as our partners. Next slide. So basically, our recommendation is that intra-action reviews are valuable exercises that enable countries to recalibrate their responses. And in this case, in South Africa, it has really benefited us greatly. And the intra-action reviews provide great inputs for adjusting the system and plans for readiness for a potential resurgence. And the issue of continuous engagement with communities and all the partners at local and international level ensures that we are able to strengthen our non-pharmaceutical interventions, such as social distancing, wearing of masks, hand and respiratory hygiene. You need the community to respond at that level. And lastly, we still, the COVID-19 is still within us, and therefore need to remain vigilant to continue to fight together. We are quite clear that it needs an all community, all government, and everybody's participation to fight. And the strength of the intra-action reviews is to actually revive that understanding amongst all of us, so that as we move on, we are actually better prepared to respond. Thank you very much for the opportunity to share the ideas. Thank you very much.
Thank you so much, Minister Mikezi. Thank you so much for sharing South Africa's determined efforts to tackle COVID-19. I would now like to turn to the Minister of Health of Indonesia, Dr. Terawan Agus Putranato. Minister Putranato, the floor is yours.
Dr. Tedros, Director General of the World Health Organization, my fellow colleagues, Minister of Health from Thailand and South Africa, ladies and gentlemen, good morning, afternoon, and evening. It is a pleasure to be invited and participate in today's event. The Ministry of Health of the Republic of Indonesia, supported by WHO Indonesia Country Office, has conducted a national interaction review for COVID-19 response on 11 till 14 August 2020. The IER is an immediate follow-up of the fourth IHR COVID-19 Emergency Committee meeting recommendation that was held in July 2020. Surely it is not an easy task to bring representatives of 138 multi-sectoral stakeholders to conduct a review of the existing COVID-19 response activities in Indonesia. However, under the leadership of President Joko Widodo and the coordination of the COVID-19 Task Force Chief, General Luhut Binsar Panjaitan, representative from the technical unit within the Ministry of Health, other related ministries and government agencies, the national and regional COVID-19 task force, military and police forces, provincial and district government, hospital and primary health service facilities, laboratories, universities, professional associations, state-owned enterprises, and international organizations have been committed and been actively involved and contribute to the whole process of the IER. The involvement of the multi-sectoral stakeholder on the review is imperative in gaining a multi-perspective view of the COVID-19 response in Indonesia. This is particularly important because the IER in Indonesia covers the 9 key pillars of the COVID-19 response, which consists of the pillar of 1, command and coordination. 2, risk communication and community empowerment. 3 surveillance, rapid response team, and case investigation. 4 point of entry, international travel and transport. 5 laboratory. 6 infection control. 7 case management. 8 operational and logistic support. And 9 maintaining essential health services and system. Indeed, active participation of such multi-stakeholder is a key for a success IER. Equally important, the multi-sectoral involvement in the IER has also increased the acceptability of the IER recommendation by all stakeholders. As a result, the IER recommendation have been used in the revised COVID-19 health sector operational plan at the national and subnational level, as well as in updating the COVID-19 partner platform. IER recommendation contribute to the improvement of the multi-sectoral stakeholder command and coordination at the national and subnational level. It also strengthened the periodic monitoring of response plan indicator, including surveillance and laboratory coordination, as well as improved contact tracing, testing, and triage at health facilities to avoid exposure of patients and the health workforce to COVID-19. Enforcing the implementation and monitoring of large-scale social restriction and empowering the community as agent for change through COVID-19, key messaging and engagement were also considered as one of the area for improvement. Furthermore, the IER suggested improving telemedicine to prevent COVID-19 exposure and maintain essential health services such as immunization, tuberculosis, HIV, and non-communicable diseases program as part of ensuring the continuity of essential health services. Indonesia, which also include the IER result as a reference for the HR State Party Annual Reporting in the 74 WHE. Ladies and gentlemen, Indonesia is of the view that reviewing the operation plan of COVID-19 response through the multi-sector stakeholder interaction review is one of the best practice to collectively identify best practice, gaps, and contributing factor for correction action in the COVID-19 response effort. From our point of view, the result of the IER review has provided input for Indonesia to improve multi-sectoral preparedness coordination in line with the multi-sectoral preparedness coordination framework that was published by WHO in May 2020 to strengthen coordination for a better health emergency preparedness. Thank you. Terima kasih banyak.
Thank you so much, Your Excellency. Terima kasih.
Hi, we are trying to connect with Dr. Tedros, so I hope it will be solved very shortly and quickly. Dr. Tedros, we lost you, but we are trying to fix the problem. Yeah. So we are trying to connect again with Dr. Tedros, but once we are trying to fix this, I would like to remind journalists to raise their hands if they want to ask a question, to get in the queue, and I would like also to ask them to unmute. Dr. Tedros is back, I was told. Dr. Tedros, are you with us? Dr. Tedros? Dr. Tedros, can you hear me? Yeah.
Can you hear me?
Yes, very well, DG. Go ahead, please.
After, I think, the interruption, it needs 30 seconds to unmute. That's the configuration. So I was hearing your voice, but not mine. Okay, so I was saying terima kasih to His Excellency Minister Putranato for sharing Indonesia's efforts to suppress COVID-19. Your Excellency, terima kasih again. By conducting reviews in real time and sharing lessons to the world, these three countries have reflected a blueprint for how countries can suppress COVID-19 and break the chains of transmission. You can do exercises, you can do simulations, but the best time to look at your emergency response capacity is when an emergency is happening. That's when you can clearly see what works, what doesn't, and what you need to improve. There is hope, and now is the time to double down on efforts to tackle this virus. Wherever a country is in terms of the outbreak, countries can turn it around by driving a whole of government and whole of society response. It's never too late. While we invest and test vaccines to prove they're safe and effective, I encourage all countries to learn from Thailand, South Africa, and Indonesia and work to suppress this virus today with the tools in hand that we know work. We can save lives and livelihoods and end this pandemic together. I thank you.
Thank you, Dr. Tedros, and our distinguished guests. I will now